day here begins with a prayer. For the nervous patients and for the staff at the Ndlovu clinic. A few years back, accused by government of poisoning their own people for handing out medication for HIV. Now fighting to catch up for lost time. This is a day like any other for the centre's head of clinical medicine. A 9-year-old boy has been brought in. Kamani Masemola groans in pain because tuberculosis has spread to his brain. He was born HIV positive and at some point stopped taking his drugs. His immune system is breaking down. Several calls later, an emergency unit agrees to take him in. Most public hospitals are overburdened as it is. Sedated, the child is taken by ambulance. It doesn't look good.
If you only concentrate on just dishing out the tablets and not the other aspect, then you are losing the battle. If it's a child like this, you have to also look at the caregiver.
With resources at hand, outreach here is a luxury many others can't afford. Prevention primarily, if not that, early detection and treatment consistently for the rest of a patient's life. Now, in some instances, patients are known to travel several hours just so that they can be treated at this particular clinic. So doctors here are obviously very positive about the impact they're having, but at the same time know the massive scale of the challenge that they still face. Because it's estimated that of the 5.7 million or so people that are HIV positive in South Africa, less than half of them are actually receiving treatment. And the system is already strained, in many ways a victim of its own success. Double the number of detections, double the resources required. Or double the wastage saved. At the Helen Joseph Hospital in Johannesburg, a robot now dishes out antiretroviral pills. It's a pilot scheme for now, where an antiquated paper filing system has been computerised, cutting waiting times from more than 4 hours to 40 minutes maximum. The savings in time and money have revolutionised the entire operation and freed up resources.
We want to make sure that they're using the medicines correctly, and that happens if they've got pharmacists who are looking after them, who are providing counseling, who are providing pharmaceutical care. And you can only provide that if you are working in an environment that is allowing that to happen.
Nelson Mandela actually had picked up the phone and called every single one of the...
The head of the project remembers the moment in 2003 when ministers finally spoke out. The result was a belated rollout of state-backed care, but much of the damage was already done.
President Zuma has really done a fantastic job in appointing Erin Motsoaledi as the Minister of Health and expanding the available resources. So the task is almost endless in my lifetime.
That's led to low morale, something the Minister of Health says can be raised.
30% of all people who are on ARVs on this planet are in one country, visiting health facilities in one country. I mean, that has to be overwhelming. Only those who really have to be in a clinic or a hospital must go. The others who are just receiving treatment routinely, can you find an alternative method?
Across the corridor from the palliative care unit, Martha Skosana has just given birth to a baby girl. A big success has been reducing mother-to-child transmission, now nationally at just over 3%. But 600 people are dying every week and infection rates aren't coming down. Much has been done, but the tide seems almost unstoppable. Guy Henderson, CCTV in South Africa's Limpopo province.